I'm so glad that you could chit chat about your experience of going through the program. So let's start with saying like what your name is, what you've experienced, and what you're going through before we started working together.
Okay, so my name is Desika, and well, before the program with Dr. Faith, I basically was feeling like crap, and she knew that from the very, like you said, I wish she could have recorded us to kind of see how that went, but I did not have energy. My energy level was probably, I don't know, I would say 1 at a scale of 10. And I just honestly, with a lack of a better word, I just felt like awful. I felt just awful. Not depressed, but just not there with it. So then following the program, seeing you on TikTok, of course, first. I decided to join, exactly. And I decided to join, and like instantly within the first, I would say 2 weeks, honestly, like I saw a difference, because that's when like the whole water intake happened, and like kind of just getting to know you, and then having other groups of women, like knowing that they're going through the same thing, like helped me personally too. And to where I am now, it's a complete 180. I mean, like I said, down 40 pounds. Like I'm super happy. Like I'm telling, like people could see the difference in me. Like you said, my libido has changed completely. So yeah, I'm very grateful. I'm forever grateful. Yeah.
Oh, that's fantastic. Yeah. And you deal with PCOS. Like tell people a little bit about your past medical history and like what you've done before.
Yeah, exactly. So I have Hashimoto's and PCOS, so it's a little bit harder to kind of control a lot of things, like you said, hormones. Been to doctors, a bunch of doctors, like in different cities even. Like I'm from a small place in Texas, so I went to different cities, bigger cities, and everything's the same as, just take this one medication. Maybe we'll add one more medication, and then, all of a sudden I'm not even diabetic, and it's like, let me get you metformin, and let me get you all these other types of drugs, which I am a pharmacist. So I believe, exactly. So I believe in there's a place for them, but just I personally didn't want that for me, because I know that our body is a beautiful machine that knows how to work itself when it can. And as far as hormones and stuff like that, so yeah, I didn't like that. Nobody was hearing me and nobody understood me. They're like, yeah, like that's just because you're eating wrong, or that's because you know it's going to be slow to lose weight, or things like that. When I couldn't even lose 40 in a year, I could do in like 4 months or something.
Yeah,
so
that's nuts.
I feel like people need to listen to that, and so you did. So again, that helped. Like, hey, try this, try that. Like I never, again, as a pharmacist, these things, but you don't know how to work it together when you have an expert helping you.
Yeah, integrative medicine, man. There's an area that's in between, and I use pharmaceuticals when I need them, so I totally understand. And there is definitely a place, but your body can definitely make all those things there. So
yeah, exactly.
In terms of the program, what was your favorite aspect of it that made the biggest impact that made the biggest difference that you didn't really have with like traditional doctor's appointments or one-on-ones?
Oh, okay. So definitely, like I said, the supplements, definitely, like I said, that type of help. Like when you saw my labs type is like, hey, this is what you need to work on. Like I said, I could see labs and I could interpret it, but it's different when you know what to use, Second thing would be like that you had those group calls, because to me that held accountability for me too, because it's like, okay, if she doesn't see progress too, like, remember, it's all on me, but at the end of the day, you don't want to let you down either. You know what I mean? So it's kind of like the same thing. Well, because then other people see, so that's where I was. So I felt like I loved that. That was a big success for me, or a big that I loved. And then, like I said, those not recipes, but the food groups, where I could know like, hey, like, oh my God, I didn't even know this helped like for PCOS or Hashimoto or anything like that, or thyroid. So those were what I liked about it.
That's awesome. Oh, I love it so much. And it just warms my heart to be able to be a part of this journey and to see how you've changed completely, to go from crazy irregular periods and low moods and weight and all these other things that you're dealing with, to now you're bouncing off the walls and you have the biggest smile I've ever seen.
Yes.
And it's 3.5 months. I mean, you've made amazing progress. Yes. Okay. One more question for you.
Yes.
If you had any piece of advice to women who are suffering with things that similar to yours, having both Hashimoto's, having both PCOS, and going through everything that you have, what would be that one piece of advice or something that you would tell them that would help them with their journey?
Sure. To definitely not listen to people when they say it can't be done, for sure. Like that's 100%. Like there's no such thing as this is all we could do. You know what I mean? Don't listen to that, because there are people that will listen to you, as such as yourself. And obviously it's a testament. I myself am a testament that it does work, with the right people listening to you. Because if you're dismissed, you feel like something's wrong with you then, like, oh, I must be crazy to think these things, but it's not. Like, if you're not crazy to think these things.
No, you're not.
So yeah, I would just say, please don't give up on listening, that this is it, you know?
Absolutely. Well, thank you so much for your time. I really appreciate it. I know these people are going to feel the words of wisdom that you have, as well as just the huge impact that your words are going to have on other people, because they do, as long as they don't give up hope, they're going to be able to figure it out, whether it's through working with me or any other functional medicine doctor.
Exactly.
The answers are completely out there. So, all right,
Yeah.
I'll talk to you later. Thank you so much for your time.
Thank you.
Bye.